We'll be having a conversation with the governor of Nakuru County, the Honorable Kinyanjui, shortly. Before that, we'll hear today's proverb from C.T. Muga.
Do not allow the belly to make you useless.
Do not allow the belly to make you useless.
Yes.
Okay.
It's like saying be useless by all means. But please, don't let the belly be the cause of your uselessness.
Be useless if you want.
If that is your choice, please carry on, but don't let it be the belly.
Okay. So, Nakuru County is one of the 5 counties that have been classified as the one zone of the disease area. And this is one of the counties where you cannot get in or get out if you are not coming from any of the other 4 counties. So you can come out of near the border with Taita Taveta, all right? Cross all the way to Loitoktok, cross over into Nairobi, cross over into Kiambu, jump over into Nakuru, because between, if you use the highway between Nakuru and Kiambu and Nakuru, there is Nyandarua County. And then you get into Nakuru County, go all the way to Mau Summit at the border with Kericho County. But you can't go to Kericho because of containing COVID-19. Now, also we know that Nakuru is one of the counties that over the last couple of months has been bearing some of the weight. When hospitals in Nairobi get full, people are looking for the next place that they can go to, and they end up in some of the facilities in Nakuru County. Already, Nakuru County was recording a rising number of COVID-19 cases seeking hospitalization. Now, the governor, Kinyanjui, joins us on the line, and we want to have a conversation with him about what the county government has been doing to alleviate the suffering of the people, especially when it comes to COVID-19 and seeking hospitalization. He joins us on the line now. Good morning, Governor.
Morning, Eric, and I'm happy to be online today this morning.
Asante sana. Welcome to the Situation Room. If you were here in the studio, we'd have given you a hot seat. But for today, allow us to convert yours into a warm seat.
Sure.
So, Governor, Nakuru is now in that lockdown. Last year, it was the Nairobi Metropolitan. And then Nakuru was spared. This time, it's there. What has been the reaction of the residents of Nakuru County when they heard that now they are locked down?
I think it is correct to note that the reaction was not very positive, especially when you look at the business community, because lockdowns have the tendency of curtailing business, reducing working hours, completely shutting certain businesses like in hospitality and transport. But we cannot talk about the reaction without looking at what other consequence would have been there if no action was taken. And I want to confirm that when you look at the graph of infections from when the disease started in March last year, I think where we are is even much higher than where it was at the worst time last year. So indeed, there is no way that the country would have just sat back and did nothing, because unlike before, where the perception was that the disease is coming from foreigners and they could lock our airports, the disease now appears to be right in the community, and therefore actions targeting community spread was both necessary and important at that particular time. So it is true the business community is not particularly happy, but I think they are also not equally happy by the fast spread of the disease, and especially given that almost everybody everywhere can relate to a friend, a brother, a sister, a cousin, a colleague, somebody known to you who has been infected and in some cases gone as a result of COVID-related complications. So I think we are not happy for sure, but these are both necessary and important actions that the state took to safeguard the interest of its people.
It's true, and in fact, the county government of Nakuru has lost some of your very senior people as well, and it's our opportunity now to actually pass our condolences to your government as well for the loss of your chief executive, chief officer in charge of health, Mr. Kingori, who passed away. He was one of the people who were very active in terms of working out the measures that can be taken in the healthcare facilities to address COVID-19 and the effect of COVID-19. Now, what is the situation like in the health facilities in Nakuru County with regards to people seeking hospitalization, your bed capacity in isolation wards and in HDU and ICU?
Okay, thank you. So first, it's good to confirm that, yes, last week we actually buried two of our senior colleagues. One is Mr. Chebuchok in our political office, and the other one is Dr. Kingori in health. And all died because of COVID-related complications. And since then, a few other officers had also turned positive, although their cases were not very severe, and some have recovered and gone back to work. But the severity of this third wave is unlike what we saw in the past. So it was necessary for us, even as a county, to close some of our offices, which we have already started. With respect to the state in our hospitals, I think first, as I heard you mention, Nakuru, just like maybe Nairobi, tends to get a lot of flow from other counties that are around us. Whenever they have a problem, they will bring their patients to the next big town or city around them. So it is true that sometimes in Nakuru you'll find that maybe 40% of the population you're dealing with that is sick is not from Nakuru, and therefore also closure of borders helps to address that particular matter. Then we must say that in our coordination efforts, we have come up with a program working with both the private hospitals and also the public hospitals. And the big issue around this time is the provision of oxygen, because a lot of the patients who have turned positive will tend to require oxygen almost immediately. And now the focus has gone towards now beds, provision of beds, and also oxygen. And I think for now we can say we are relatively okay, but numbers can change drastically. And that is why we have started our campaign on prevention, supporting also government on the containment measures, and also more importantly on vaccination. So I think our three-pronged approach is prevention, respect the containment measures, and then also work on the prevention. For oxygen, allow me to confirm that we do manufacture our oxygen in our hospital at level 5 in Nakuru, which we use in all our other facilities. And although I must say we have increased the bed capacity, the truth is there's no hospital, even country, that can be able to meet once COVID is on full swing. So I think the idea is to keep increasing. And I think as a county, we are also in that process. Our ICU beds are about 22, but we are also working with private hospitals because, as we know, when it comes to healthcare, there are no private or public. We all must work together. And that partnership has been very useful in the last few days.
Your Excellency, what would be the ideal number of ICU beds in an ideal situation that you think a county such as Nakuru ought to actually have?
I think it's good to confirm that the nature of this disease is very unpredictable. Actually, when I look at the data, just some 6 weeks ago, we were actually very low. Then there's a very sharp increase. So ordinarily, without COVID, 22 is a very good number. Actually, let's also be honest. Prior to this COVID, most of our public hospitals did not even have a single ICU. That's across the country, not just Nakuru. So 22 is a good start for public hospitals, but also the private have also increased their capacity. But given the trend of the disease and the unpredictable nature of days to come, we think working with around 50 for Nakuru would be a good idea. And to that extent, I've already started working on Naivasha, our Naivasha level 4 hospital, to try also and put maybe another 10 or so beds to address those acute cases that come and require immediate redress.
Governor, one of the issues that has come about, I mean, looking at some of the things that you're doing now, obviously it's not a wish in the sky and then these things drop. It's obvious that, you know, funds are going to this. And one of the reasons why your counterparts in other counties have said they are not able to do this is because of the funding. how are you being able to maneuver? How are you being able to work this out? Because even if you're adding 5 ICU beds, for example, it's a considerable, or it's a significant addition. How are you able to do this without extra funding?
I think this is a question that requires immediate national attention, because the nature of COVID is, if you have a patient who is sick, them admission on account of them not having the money. 2, even when you admit them and they are there and they incur a bill of even 200 and they cannot pay, you cannot detain them longer because you need that bed to be taken up by the next patient. So counties are having a very huge burden that is going to bear adverse effects on agriculture, roads, and other areas. But I think for Nakuru, if I may speak specifically about Nakuru, the idea is, obviously we are constrained, that is a fact. But what we've tried to do through our supplementaries is to get resources from other areas that are not under emergency right now, and focus all our efforts on health mitigation. And it is for that reason that I've said we want to add ICU, for example, in Naivasha and a few other places. And maybe also add a few ambulances, because now there gets a time when if you put all your ambulances on COVID issues, then a patient, a mother delivering, will not be able to get service. Another accident happening somewhere may not be able. So we may also need to increase our ambulances and so on. So I think right now the next conversation we expect is that after the president declared the lockdown and where we are on this COVID mitigation, the next thing must be a rescue package for the counties, so that even as we waive, for example, certain fees, because it is not possible for county to continue receiving normal revenues, including from bars, when those bars have closed. So there must be decisions that have to be made to see how we can reconfigure the budgets and the financial aspects of running the counties. Otherwise, we'll get to a situation whereby workers are not paid, there's no oxygen, there's no medicine, and so on. And I think that would not be a very good thing. So right now, the next conversation must be around what package can we give to the counties, because about 94% of all the sick persons actually go to county hospitals. National government hospitals are probably just here in Kenyatta, Moi Referral, Mama Lucy. The rest is actually under county government. So how do we manage that equation now that you've declared this issue an emergency? That's where we are.
Your Excellency, there's something I'd like to ask. As a county, what measures are you taking to ensure that there's compliance with these COVID rules?
With respect to compliance, we are working with enforcement agencies, including our intelligence teams, our county commissioner, the police departments, the DCI. And why we need all these teams working together is because there are aspects that relate to public transport, where we need now the traffic policemen to behave. And even yesterday alone, I have received hundreds of complaints that a matatu that should otherwise carry 8 people is probably doing 15 or 18. And it defeats purpose that a person the whole day has been social distancing, and on their way home, they are cramped up in one matatu. So again, we need to work with the traffic to ensure that the issues of social distancing within public transport are enforced. We are also working with professional bodies, because we must also agree that people work during the day in certain environments. And the people who run these institutions must agree that we must also reconfigure our working environments, including our markets, including our supermarkets, and wherever you want to imagine that people go, so that the issue and concept of sanitization and social distancing is respected. And I want to confirm that through that multi-sectoral working group, we have had progress. Yes, there are challenges, but we've had significant challenges, because in terms of information, we are fed on areas where we require to improve. Then we are able to send the necessary teams to go and work. But I think the magic bullet lies in public awareness. There are no rungus enough to force people to do what they don't want to do. But once you're able to win their hearts, and this is where also the media becomes very important, for people to realize that curfew time is not, you're not going home because the policeman is going to arrest you and so on. But because you realize that it's during this social time that people often have a drink, are talking and doing those, and therefore the probability of increasing infection also goes high. So for that reason, we want to cut that social connection that has been a problem. So as long as people have not understood that, then we will have to use very heavy enforcement that may not be very. So we must also agree from the onset, the inclusion of leaders at all levels, be they religious, community leaders, elected leaders, is very critical in ensuring that the public buy-in is there, so that you feel that you owe it to yourself. And I'm happy a couple of people also called me yesterday and told me that they have reconfigured their working setup because they have also seen the seriousness with which COVID has hit the country. So that is the approach we want to have. Yes, we want to enforce, but also we want to engage the public so that we increase the buy-in and that they become soldiers in this whole war against COVID, as opposed to them being the ones being chased and run by everyone. But human behavior is obviously complicated, and enforcement will also be equally key.
But Mheshimiwa, I agree with you when you say human behavior is complicated, but at the same time, it's actually fairly simple. I mean, one of the things about enforcement of these COVID rules is the direct impact it has on the earning capacity of most Kenyans. And this is something I'm sure you encounter on a daily basis. It isn't an easy situation that you have here. It isn't, and I don't think there are easy solutions to this. But unfortunately, difficult as it is, solutions must be found. As a county, what are you doing to help the citizens of your county deal with the economical pressures that are being brought to bear on them because of COVID?
Thank you. As you may be aware, these measures are probably just about 4 or 5 days. So we have a team that is currently sitting down to draft probable measures that would be acceptable and are also useful. And I must say, like have hinted, areas like bars and hotels that have had to close, it would be extremely wrong for you to charge them when they're not even operating optimally. And the other sectors also that would require to be checked. But maybe for us, what we thought, instead of doing a hurried, just easy gesture, we also wanted to study and also consult with the same private sector. Then in the next few days, we should be able to come up with a package on how we can help the public also go over this period. But I also wish to confirm that yes, the times are hard, but I think also the impact of you having a brother, a sister, a wife, or a son who is sick in your house is a bigger economic problem than you even imagine. So I think sometimes you have to look healthy and not having all the opportunities to make the money, vis-a-vis, I am sick, I'm at home, and I don't know what to do. So I think the choices we have to make are not necessarily one of working normally as if there is nothing, but one of which is the lesser evil within this whole spec. And I think for the many people we have in our hospitals, we have about 100 people, nearly 100 people on oxygen at any one time in the last few days. If that question was posed to them, I am sure you know what answer they would give you. So I think the time for caution is now. But we also need to be ingenious in how we look for ways of putting bread and butter on the table.
This is Kenya's biggest conversation, The Situation Room, broadcasting on Spice FM, on KTN Home and online. In the room with you this morning is Nduoko, CT Muga and Eric Latif. Joining us on the line is Nakuru Governor Lee Kinyanjui. We're talking about the measures that the county government of Nakuru is taking to cushion the people with regards to COVID-19 and also to address the rising number of cases of COVID-19 in the country. Governor, as we were going to the break, we were talking about the kind of cushioning that your government can do to the people. We have already seen, for example, in the case of Machakos County, which is one of those that have been declared part of the one zone, the governor in Machakos has already announced the measures that can be taken. You've said that your team is out and it's looking at what kind of measures can be taken. But how can you assure the people who are watching you this morning that there's something that can be done and can be done immediately to address the plight of the people who will obviously be affected by this lockdown?
I think it's not possible to say that the counties can do everything to flatten the effects of COVID. It's not possible because nobody, not even national government, has that kind of funding that would help anybody to stay at home, even when their job has ended.
Mm-hmm.
However, we can look for ways of creating opportunities so that even if hotels are closed, how can we help to encourage, say, home deliveries and home cooking and so on? Because ideally, people will still eat. I think that's a fact. So if people will still eat, how do they eat without endangering the COVID infection issues? So I think those are the issues we need to look at, because sometimes we can be tempted into simple tokenistic sort of approach, where we say, okay, you're supposed to pay 20,000 for the whole year license, you don't pay. That's okay, but that will not put bread and butter on their table. So beyond just waivers here and there, I think the bigger issue is to try and look for opportunities that also exist within that lockdown space. Noting that lockdown may not be necessarily 1 or 2 months, you don't know, it could last 6 months. If it lasted for 9 months, what would happen to people whose jobs have completely changed? So I think our approach is more on sustainability, more on creating innovations around this period, and also encouraging those who are already working and their businesses are compliant to this COVID-19, how they probably can expand and employ 1 or 2, 3 other guys. And through that way, also we can try and reduce the hopelessness and desperation that we have in the economy.
Yeah.
But also moving forward for our counties, assuming we will have other mitigations, including buying food for the vulnerable and sharing with them. Again, opportunities we would want to give to persons who have been affected adversely by this. So we don't want to look at it from a simplistic, quick way, but maybe also to look at what each action is likely to have on the broader aspect of the economy.
I like what you're saying, Governor. I like what you're saying.
Also,
however, Governor, it's been a year. It's been a year since we had COVID-19. Last year, the whole of last year, you saw what was happening to the economy. Surely you would have expected that maybe you had a team that was already working on, should we go into a lockdown? Should this situation worsen? Let's have something in place, some ideas in place that can be rolled out immediately.
Oh, no. We already did that even in our first phase. But each phase, you see, like I said, this third wave strain is very different from the second one. And its seriousness, once it affects the body, is much more serious than the second one. So we expect these particular containment measures to be even maybe more stricter as we go on than the previous ones. However, we had a platform, and last year we even gave food to some of our vulnerable groups across some of those areas. We gave cash. Maybe it can't be enough, like I said. We also had we worked with the private sector, including Red Cross, on how to reach the most vulnerable. So we had a comprehensive approach, and I think we may not have achieved everything, but there was a significant level of success last time. So that is what we are trying to work on currently. And I must say this one mainly also affects the urban, what you call the urban poor, the people in the slums, but in the rural areas, the impact tends not to be very big because access to food and the rural economy operates on very different dynamics. So because my county has both economies, rural and urban, we also have to look for interventions that are specifically targeted to specific areas. And also working together with the private sector, because nobody can claim to have a monopoly to the answer to all these issues.
Sure. I think a lot of times when we look at some of the measures that are being put in place or what county governments then are able to do, it is unfortunately, and I say unfortunately carefully, but it is unfortunately pegged to what the Treasury will be able to release in terms of funds. And I've always been of the opinion that even in a devolved system, that counties should be able to look at own source revenue. Are there plans in place? Are there things that you can look at? Because even as you speak now about, looking at the less vulnerable, or rather more vulnerable in society, look at those who are living in slums and look at mitigation efforts to help them. This is all fund intensive. It's funds intensive. I mean, whether we like it or not. And counties right now are depending on that money that they get from Treasury. Are we going to be able to look at a time in the near future whereby there would be revenue building, creating activities within county to be able to support the efforts of county within county?
I think it's true to some extent that the dependence on treasury disbursements has been high over the years. But allow me to talk about Nakuru and say that much of our interventions also rely on our local resources, including our revenue collection, working with the private stakeholders within the county. But I think moving forward, there must be a deliberate attempt to try and ensure that the revenues are not too much dependent on the national treasury. Because the national treasury also has its own challenges, and they are part of this economy that we are also seeing is depressed. However, I must confirm that as a governor or a county for that matter, you are now choosing between two very difficult situations. Your local revenues include the license from the Mama Mboga, from that matatu, from that tuk-tuk rider, whose businesses have been adversely affected. So as you push to increase your revenue, that is the guy you'll be going to tell, bring your money.
Sure.
The bar owner whose bar has been closed, you'll be telling him, I want my license regardless. So you are caught, you want to increase your revenue, but your sources of revenue include some of those worst affected areas, including the hospitality industry. So I think it is a trade-off that one has to look at very carefully. Where you must collect, you collect, but also appreciate that now our demands for health for the next future, we don't know how long. Again, like I've said, COVID patients, you cannot detain them, you cannot refuse to treat them. So it becomes very complicated. You want more revenue, you become more ruthless to a community that has been disenfranchised, whose businesses have been closed by these restrictions. Again, you will appear to be a bit insensitive. Then again, if you leave them, your revenues go down. You are therefore unable now to cushion even those poor of the poor. So I think it is, to go to call the media and say, I've removed this license, this license, this license. Eventually, when you look at your revenues, you realize, 300 million has gone down. Then on the same breath, you are now being told we need oxygen in a certain hospital, we need to employ more staff, we need to get more ambulances, and all these sort of stories. So again, you are in a bit of a tricky situation. So I think it's important to look at all these issues in fullness. And also to confirm that it is unfortunate that what you may call the miscellaneous or emergency fund in counties is very small. So there's no county that today can claim to have some 300 million for emergency.
Yeah.
There's nothing. There's no such a county. And even when you go and give those waivers, it will have a direct impact on your revenues. Your revenues will now have direct impact even on your ability to pay salary. So do you want a situation where you see our nurses on the road again because they did not receive their salary allowances? So these are the questions when you're in a position of making decisions that you have to balance, because you otherwise end up making very sweet-sounding statements, but later on you have to pay dear. So I think that's why we said we would want a more reasoned approach.
Your Excellency, do you think, hypothetically speaking, of course, that if the share that the counties get from the national cake were increased significantly to the percentages that we've heard politicians saying they could be increased, and if the counties had more autonomy in terms of not just revenue collection, but more autonomy in terms of seeking to form partnerships, business and otherwise, with other entities, if this were allowed or if this was a reality, do you think the counties would be in a far better position to manage their affairs than they currently are?
I have no doubt that that's the way to go. And also to confirm, in Kenya, we probably don't even need to think of increasing taxes. What we just need is higher compliance. Very few people pay the licenses, and they pay on behalf of all the others. So even if you look at the county level, assuming you're collecting a certain license, say bars, maybe 30% will pay.
Wow.
The 70 will not pay. And when they don't pay, maybe what happens is they keep oiling some guys who come to ask them whether you have a license.
Yep.
So you lose a lot of money. And so what we are saying, let's not increase taxes. Let's just make sure they are where they are, but you increase compliance. If you're supposed to pay your 20 bob, just pay it. If you go to the parking and you have to pay your 100 shillings for the car, don't agree to negotiate and pay 20 and steal the 80 from the county that would have gone to buy some oxygen somewhere. So I think there's a conversation that as Kenyans we need to really agree that the money we pay for specific services, when we don't, then tomorrow your house will be on fire and you ask for a fire engine and it will not show up.
Yeah.
Or you go to the hospital and you cannot get medicine. So all these actions have consequences. And I think this is really the conversation we need to have. But I must say greater partnerships are necessary. There are certain revenues and businesses that counties should be getting and they're not getting, including mining. And one of the biggest assets in any country is what is beneath the soil. For Nakuru, I would talk of geothermal. And I would say if Nakuru was to get part of what comes from our geothermal energy, we would be more than self-sufficient. And we've been able to pass the necessary legislation, including at the national level. And we are at the tail end in implementation of that. And once that is put in place, we can easily have maybe 1 billion more over and above what you're having. That can go towards mitigation of some of these effects that we continue to see. But there must be creativity in looking for alternative incomes for counties beyond just, the treasury one-sided approach to issues.
How, sometimes when you're talking to someone like a governor, you're caught between Your Excellency and Mheshimiwa. So let me use both. Your Excellency, Mheshimiwa. Now, what is your approach, the county of Nakuru? What is your approach to dealing with corruption? Or should I say impunity? Because as you've correctly stated, it is the one thing that costs the county an insurmountable amount of money and an insurmountable amount of revenue, and in so doing, hampering the very thing that your government proposes it should be doing for its people.
I think the first thing is that these issues have to start from the top. If you are in an organization and you do not live by the ideals you seem to want others to live by, then it becomes a very difficult gospel. So I think we've tried to set it from the onset and to try and reduce any aspects that may have wrong image also to the people working below us. But I would say that automation is the first way. Human beings are good, but their goodness ends somewhere there. So we need to automate issues so that if you want to pay your license, you don't need to negotiate with anybody. You go online, check your category, confirm how much you're due to pay, and maybe next year, a month before time, you can be reminded. So the first thing is get data. Once you get the data, this data now can be automated so that it's self-implementing. If you don't pay, again, we are trying to say that our revenue collection systems must be interconnected. Counties run water companies. They have a connection with KRA. They have connection with Kenya Power. We should run our system in a way that if I do not pay my land rates, for example, I should not be able to connect with my power or water. And that's how systems run all over the world. If you've not done this, if you come to apply for this, you'll be told first go and clear this. So I think the point you're trying to say, instead of the approach you've seen in the past where counties are employing more and more enforcement officers, more rungus, more those lorries we used to call Mariamu and stuff like that, we want more ICT-driven approach to revenues. So that if you don't do one thing, if you want to apply to start building your plot, they'll tell you, no, these are the 4 plots you haven't done. You want to do business with the county, this will not happen until you have cleared this and this and this. Just more or less in the same way at the national government, you have this certificate of compliance. You want to apply for this tender and you've not paid certain taxes, you'll be told, pay this so that we can give you a compliance for you to go on. So we are trying to implement the same now at a county level, so that we remove this human interface. So I think the first thing in terms of increasing revenues is removing human interface and judgment.
I'm sure you.
The second one that I
think. Go ahead.
The second one that I think is also equally important is also to teach citizens to know. We always find a lot of people telling us, "Oh, go to this country, you'll find this. Oh, go to this country." But in those countries, they tell us to go and see how they operate. they would never agree to part with a shilling to defeat paying any government fee, because they know by paying that government fee, my kid goes to school. I can go and get medicines. I'll go and get security. All those things are there. But here it is the opposite. It's very difficult to convince somebody not to bribe. So even when you go and park your car at a 5 million vehicle, you don't want to pay 100 shillings. So I think we also need to engage the public. Not to engage the public, to also appreciate that they must be the ones to say no. You know, I'm building a house. I'm supposed to pay 100,000 for building plans and all that. But somebody now tells me I can pay 20,000 and do something. So we must also kill corruption from now, what we call the demand side. Kill the demand. The people who demand to bribe also, you must tell them, this is not the way to go. Pay the 100 and demand for your services. So this is a conversation which we now call public awareness that must be there. And also to confirm that when the public sees where their money is going, their degree of acceptance and compliance goes high. So again, we want to say that as we do this, we need to have a place we can tell you, this is where your money is going. This is the road we've been talking about. This is the hospital. These are the medicines. These are the people we are paying. So that discussion needs to be encouraged as we move.
And how far are you with this discussion, Your Excellency?
As you're aware, I'm also having it as we speak now. But we started it even within our department. We started it with the public. And simply saying that giving a bribe is robbing yourself. Actually, you're not even robbing the county. It's not the county that will be sick. It is you who will be sick tomorrow. Your wife will be going to deliver, and there will be nobody to take care of them. A couple of years back, our workers would not be paid on time. Sometimes it would take a month. They were never sure when they would be paid. Now we can say with certainty, every 28th you will be paid. And it is not a favor. It is, you can also plan. So these are the discussions we really need to have. And we need to broaden the conversation to also make everybody appreciate that by giving that 20,000, 1,000, whatever the situation, you are actually not helping the situation. You are putting us far back from where we were. And I think for me, the quick way of trying to increase taxes or the rate is a simple way of solving a very complicated issue, because with even maybe 60% compliance, we'll have a lot of money. But now very few people pay, but pay on behalf of many others who don't pay, but instead bribe to remain afloat. That conversation must be ignited at all levels.
And we must continue. As you talk about compliance and automation of revenue collection, I can imagine that your biggest impediment to this would be your own staff. Have you encountered this, and how do you deal with that? How do you make sure that your staff are on board, that they can accept to automate and not to sabotage the efforts that your government is coming up with?
Okay, so what we did, we came up with what you're calling the Nakuru Revenue Authority, which essentially mirrors the KRA. And we want this to be a quasi-autonomous body that will collect revenue, and they will use 2% of the revenue they collect for their operations, like salaries, vehicles, rent, and all those other issues. We will employ a fresh set of people in the coming few months. And the reason we are doing this is that if you look at revenues in counties, the year to election is a very difficult year for counties, because the revenues always go down, sometimes by 20%, 30%, because of lack of focus. But when you set a semi-autonomous entity there, give them targets, make sure that they are well anchored in law and all those other things, then the situation changes completely. And that is what you've seen at the national level. Secondly is that, yes, we'll have resistance from county employees, but a county doesn't have a permanent employees. If you're going against county policy for that matter, then we have ways of dealing with those sort of situations, because the county is not employed by its employees. It's the county that is employed. So who should follow the other? So if we now say we'll only do that which makes them happy, and maybe they are beneficiaries, and I want to say it's not all of them. There could be a small group of people who benefit from this confusion. So confusion is a very big industry in this country, and many people would want it to exist because it benefits a few. But do we want a system that benefits a few, or one that benefits all of us? So that's why we're saying we want to automate. So at any one time, if you wanted to see your your fee paying, your license paying behavior in the last 5 years. Just like you have the CRB, you can be able to see you've been paying your obligations on time. And some of these things can also be linked to CRB. If you cannot claim to be a very responsible person when you don't meet your county obligations. So I think there are ways in which we can be able to connect with other institutions and also empower the public to appreciate the importance of meeting their obligations. And from there, I think we are going to see a semblance of order in the days to come. But I think the first arena is fighting with a mindset that perceives paying licenses or rent as a waste of time or waste of money. And I think this, so they are therefore ready to go all lengths to beat the system. So once you're able to convince them that it's in their best interest to work in a certain way, to behave in a certain way, and they stand to benefit, and their mother who cannot be able to go to the big hospitals will now go there and get diabetes medicine and diet advisory, then the conversation changes. So I think we want to say we cannot walk alone on this, and the public becomes a very key pillar.
And so this is not a Lee Kinyanjui led conversation, then, from what you're saying, but that it is a systemic change and establishment that needs to come about, so that if tomorrow Governor Kinyanjui is not there, that the systems are running, and these things happen. So whatever comes in place, whatever happens, emergency, COVID tomorrow, something else, that the systems have already been set up and are running smoothly so that everybody has an understanding of what's going on. And regardless of what is happening at that time, the systems will be running. Is that what we're trying to do? Or is it a character-led initiative now that if you're not there, this will not happen?
I think both ways are also correct, because even if it is institutional, it needs leadership. There must be that, where did the idea come from? What's your vision? How do you plan to do it? So to that extent, I can say I believe in that. That's the way to work around that. But beyond that, also to confirm that we have enacted the necessary legislation to ensure that this Nakuru Revenue Authority now is a legally constituted entity, so that sustainability is over time. We have also said that they will not rely on funding from the county, because what will happen in subsequent years is if somebody does not own this organization to work, they just need to make sure that there's no funding, there's no salary, and before long they wind up. So we have put a self-implementing mechanism in this particular bill and this particular authority. In the recruitment, we'll also get the best professionals who can be able to move up to the next level. So I see opportunities for growth. I see opportunities for sustainability. And as I said, it is not anchored on me. The money that comes does not come to me in person. It comes to the organization. And how it is used, again, it is subject to public scrutiny. So the only thing I can take credit is just the vision and the dream. But the implementation and the future sustainability belongs to the people of Nakuru.
If we look at this enforcement that is now required of COVID-19 protocols that were announced by the president, one of them is saying that Nakuru is part of the 5 counties that have now been locked in. But there has been complaints about traveling from Nairobi to Nakuru or vice versa, where many of the traders from Nakuru County who would like to access Nairobi are having difficulty crossing the gap there that is Nyandarua County on the highway. Has there been a conversation to address that particular anomaly?
I think it's good to confirm the first few days of any exercise of this nature will have these short-term teething challenges. But in the next few days, we are harmonizing with our security agencies to ensure that businesses that rely on supplies, a person who works in Nakuru and maybe his family is in Nairobi, we're trying to look for modalities while also ensuring that misuse and abuse is also not allowed. So in the next few days, all those things will be clarified because we have a joint working team together with our security forces and the national government and administration offices. And I'm sure we are alive to all those issues. We have courier companies that require to take. We have the medicines. We have all those things that require to be taken. But I must also say that the president's declaration was also very well thought. If you are going, say, to Nakuru, why would you be going if you don't live there? It's because there's a church function, there's maybe a funeral for family, person, or friend that you know, a seminar, and all those sort of issues. Or a political matter for that matter. So the moment you ban all political meetings, the moment you say there's no hotel sittings unless you're doing a takeaway, the moment you say funerals are only for 50, it means it's only immediate family members and the church. And even colleagues and neighbors are actually exempted in the context of that. And again, when you say you only need 3 days to bury, it means the long, protracted maombolezes have also been removed. Again, when you say there are no political activities, there's no BBI, and maybe even the issue we need to look at is these by-elections that are ongoing, because they also encourage a lot of interactions and so on. But the point is, but if you look at those restrictions that the president gave out, they are very well thought out. And even if you wanted to go to a place, you will realize most likely it is closed. The people are working from home. And that means even if you go to the offices, you will not find them. Like for us in Nakuru County, we've decided to close for the next 1 month as we observe the circumstances. So if you wanted to come to my office, you will not get me. So I'm just trying to say that beyond the physical barriers, because Kenyans are now looking a lot into these physical barriers. And the physical barriers are just to help us, that areas that have not recorded very high numbers are not also endangered by this free flow of people. And I think if Kenyans also appreciate that and don't also try to beat the system and want to appear very smart when you succeed in so doing, then I'm sure we will be able to achieve our goal, which is to really reduce the infection rates.
Governor Lee Kinyanjui, thank you very much for speaking to us. 1 minute. Send a message to the people of Nakuru County, especially now that there is lockdown and we're dealing with a rising number of cases of COVID-19 in the third wave.
I think my message to the people of Nakuru is to note with great concern the high number of cases that we've recorded in the last 3-4 weeks, and also to note that within those 3-4 weeks, about 62% are actually men, which also indicates the nature of their risk appetites. And also to note that from schools, when the schools closed, also we saw a lot of the kids who came, and actually some of them have contracted from school. The kids are not affected themselves in the sense of severity, but they become also potential spreaders to their mothers and grandfathers and so on. So we expect the next few weeks to be very critical, and therefore we require everybody's cooperation. We require you to be a keeper of the other one. If you realize that your colleague is doing certain things that actually endanger you, I think it's upon you to also ensure that you have a bit of that peer pressure to do the right thing. And also to confirm for our hospitals, we'll try to do the best we can, but no country, no matter how developed, even New York itself could not cope with the high numbers that came late last year. So no hospital can be able to get all the 2.4 million people who are in Nakuru cannot be admitted in our hospital. So our first line of defense is prevention. And for our elderly, the 55 and above, I think if it's your parent, your brother, whoever it is, please make sure we insulate these populations, because we have found that the disease is particularly unforgiving to the elderly, the hypertensive, and also the diabetic. If you have any combination of these two or the three of them, then you know you're in high category. And lastly, also, we are rolling out our vaccination. And even yesterday, we started in some of the areas. We only have 24,000, which is a very small number compared to what we really should be doing. But I think at the national level, we are also having conversations on how we can increase the vaccinations available to the rest of the population. And the end of the lockdown is directly tied to what percentage of the population we can be able to vaccinate. So the sooner we get to the 30% mark, and you can look at a 50 million population, you want to look at 30%, we're talking about 15 million people. So there's need for us to act with speed so that we can break the cycle of infections.
Asante sana, Governor Lee Kinyanjui, for joining us this morning. We hope to host you again soon.
Thank you very much.
Thank you very much.